Hello and welcome back to Langfort International Academy. This is Anne and Aquina with another OET roleplay video for you. Before we move on to the roleplay, I would like to brief the situation. So the setting is the hospital and the scenario is the nurse has come to do clinical observation on a patient who was in an accident 2 days ago and had come in with a traumatic injury to the leg which was almost at the risk of amputation. Now the leg has been treated, but the patient is still upset and wants to know why the trauma nurse at that time took the vitals before attending the leg. So let us see how the nurse clarifies and handles the situation. So Aquina, are we ready?
Yes.
All right then.
Langfort International Academy. Your passport to the world of opportunities.
Good morning, Miss Anne.
Good morning.
I'm Aquina and I'm the nurse who is taking care of you today. As I understand, you had an accident 2 days ago and injured your leg. Am I right?
Yes.
Yes. Well, I'm here to do the clinical observations, which is actually checking your current condition. That includes checking your blood pressure, pulse and respiration. But before proceeding any further, I would like to know how you are feeling now.
Well, I'm feeling better, thank you.
So, are you feeling any pain?
No, the pain has subsequently reduced.
Are you nauseous?
No, I'm not nauseous.
Okay, I'm glad to hear that. But I can't help noticing you look very upset. Is there something bothering you?
Well, that's right. I am upset and there has been something bothering me. But I'm not sure if I could ask that.
Oh, Miss Han, please don't be worried. I would like to assure you that all your questions are valid and we, the hospital staff, are here to help you. So please feel comfortable and let me know what's bothering you.
Well, I don't understand why the trauma nurse at that time took my vitals before attending to my leg.
Well, Miss Anne, actually, I can understand your perspective and why you were confused. So I'd like to clarify why we did so. Actually, variations in vital signs are the early warning signs which help to determine if there is any immediate threat to one's life. And it is also one of the most important steps to ensure a patient's safety. So that's why your nurse took the vitals as soon as you were body.
But I think my leg should have been attended first because it was at the risk of amputation.
Yes, Miss Anne. Actually, your concern is quite valid. I can give you a clear picture by explaining the normal procedure that we follow when we assess a traumatic patient. So, can I carry on with the explanation?
Yeah, sure.
Yes. So, Miss Anne, this is how it is. As soon as the patient arrives, we initially check for any obstruction in the airway, breathing and the circulation, which is actually the primary survey. And once it is made sure that these are normal, then we move on to the secondary survey. So the secondary survey is actually the assessment to identify all the potential significant injuries.
Okay.
Yes, so this should be done only after the primary survey and the initial stabilization is complete.
Okay.
Do you get me so far?
Yes.
Yes. So, Miss Anne, let me tell you on a very serious note, if the procedures are not followed properly, then it can lead to some life-threatening situations, apparently even death.
Okay, but I don't think that I was in any danger of losing life. I was alert and I could have told the doctor if there was something seriously wrong.
Yes, Miss Anne. Actually, your thoughts are really understandable, but I would like to inform you that even if a person feels alert in a traumatic situation, there are still chances of risk factors which is associated with even the slightest variation or fluctuation in the adrenaline reaction and thereby affecting the accuracy of the actual condition. So that's why we are checking the vital signs as soon as a patient is body.
Okay, right.
So do you have any more questions to ask me?
Well, no.
Yeah. So I'm so happy that I was able to help you, and also please, Miss Anne, please be relaxed, and you don't have to be worried about anything in particular. And I would also like to reassure you that all the staff are well experienced to cater any situations, and also we do the clear procedures in order to ensure your safety.
Right, okay, that makes sense now.
Yes, so far we have discussed all the things, and I think you don't have any more questions.
No, I don't.
Yes, so with your permission, can I carry on the clinical observations?
Yeah, that would be fine, yes.
So thank you for allowing me to do that.